it was just to familiarize ourselves to the infection prevention and the control. Just our jump the acronym and we'll start the chapter immediately. The objective is to just our rush by and we'll concentrate on the steps and its main benefit. By the end of this chapter, the participants will be able to practice proper hand hygiene technique. Enabling objects will be explain the importance of hand hygiene, distinguish when to perform hand hygiene, order organization 5 moments of hand hygiene in health facility, and demonstrate proper hand hygiene technique. These are the enabling objectives. So the course outline is importance of hand hygiene, when to perform hand hygiene methods, improving hand hygiene practice in primary healthcare settings, and the summary. So the 5 moments hand hygiene is the single most important measure to prevent transmission of infection, and is the cornerstone, as I previously mentioned. This is one of the very crucial actions that we take during infection prevention and control. What's the importance of hand hygiene in the clinical setting? Why do you usually wash your hands, your actual practice? So we have to just check our actual practice, and after this course, we have to take precautions and we have to improve our practice, which is the main purpose of this course. So hand hygiene is the single most important measure to prevent transmission of infection, and proper hand hygiene can prevent transmission of microorganisms and decrease the frequency of health-associated infections. The goal is to remove soil, dirt, and debris and reduce both transient and resident flora. Failure to perform appropriate hand hygiene leading cause of healthcare associated infections. And the spread of multi-drug resistant microorganism and significant contribution to outbreak. So these are the main reasons why we should avoid health-associated infections and multi-drug resistant organism spread, and to control or to reduce outbreaks. The 5 moments when we should do hand hygiene are before patient contact, after patient contact, and patient environment, after procedure, before clean procedure. So the 5 WHO identified moments when we do hand hygiene are before making contact, before performing a clean septic task, including the touching invasive devices, after performing tasks involving the risk of exposure to body fluids, like including touching invasive devices, and after patient contact. The first is before patient contact, then after patient contact, then after touching equipment in the patient's surrounding area. So these 5 moments when we are caring to our patients, we have to remember all the time that we have to do at least alcohol-based hand rub in these moments. These are the 5 WHO identified moments we should stick all the time in our care. Other opportunities for hand hygiene are immediate after arrival and before departure from work, immediately after touching contaminated instruments or article, before putting on gloves and after removing them. People might forget to wear to wash after removing gloves. But it is very important and crucial moment when we should also do hand hygiene. Hands become visibly soiled after nasal blowing, before touching the face, before and after cleaning the environment, and before and after preparing food. As we know also, before eating and drinking or serving food, after visiting the toilets, there are also other opportunities. But the very five ones are before making contact to the patient, before performing a clean or aseptic task, including touching invasive device, after performing a task involving the risk of exposure to body fluid, including touching invasive devices, and after patient contact, after touching equipment in the patient's surrounding, are the very 5 moments where we have to practice hand hygiene. The methods are, hand hygiene methods are hand washing with soap and water. Purpose of routine hand washing in healthcare is to remove dirt, organ material, and microbial contaminants. Water alone is not effective in removing substances containing fats and oil. Requires soap, which is rubbed on all hand surfaces, followed by thorough rinsing and drying. The entire hand washing procedure should take 40 to 60 seconds. Time is also an important factor. Hand washing for 30 seconds has been shown to remove 10 times the number of bacteria hand washing for 15 seconds. So the lesser the time, the lesser we remove the bacteria. So we have to make 30 seconds, and some say 20, but here in our document it is 40 to 60, so it is very sufficient to remove almost the flora and contaminants. The entire hand washing procedure, if completed properly as described step by step, takes 40 to 30 seconds, 60 seconds. So the technique, I have shared the video, but just I will say it in words, but the demonstration, you can see it in video. Just we take some clean tap water and we soak our hands, and then we wrap the soap between the palms, and then interdigital palmary and then posteriorly, and then we do the back of the hand, the right first, then the left, and then the thumb, and then the fingers goes clockwise, and then the wrist, and then we rinse. Hand washing with soap and water is recommended. Sorry. If hands are visibly soiled after using the toilet, before eating, to remove the buildup of emollients on hand after repeated use of alcohol-based hand rub. In outbreaks of Clostridium difficile, but not in healthcare setting, with only a few cases of Clostridium difficile. So in these cases, we have to use hand washing. Alcohol-based hand rub, this is the one we usually use during the COVID-19. Everybody is familiar how to use the alcohol hand rub, and this is the method that we used, and this is more effective in killing transient and resident flora than hand washing with antimicrobials. Anti-alcohol-based hand rub should be used at any of the 5 moments before and after patient care and contact and during invasive and environment touch. Alcohol-based hand rub should be used at any of the 5 moments. To be effective, we have to approximately 3 to 5 ml of alcohol-based hand rub for 20 to 30 seconds should be used. So we pour just 3 to 5 ml of the alcohol-based hand rub on palm. Then we rub the palm, then the back of the hand, then the thumbs, then the fingers, then the wrist, and then that's all. Antiseptic soap in place of plain soap during the 5 moments of hand hygiene described above, but are not recommended for most settings because it's just because of the expense, because they are also sometimes allergic to other people. So it's common soap is enough. Just we have to use soap and water. Hand wash with antiseptic soap is more irritant to the skin and more expensive than the alcohol-based hand rub. So we come to the conclusion of the summary. The goal of hand hygiene is to remove soil, dirt, and debris and reduce both hand transient and resident flora. 5 moments of hand hygiene are before making contact with the patient, before performing a clean and septic task, and after patient contact. These are the 5 moments of hand hygiene. Alcohol-based hand rub is more effective in killing transient and resident flora than hand wash with antimicrobial agents or plain soap and water. So only when there is soil, dirt, and debris, we prefer to use hand wash. Otherwise, it's alcohol-based hand rub is more effective. Thank you. We conclude our hand hygiene. Probably, I don't know, Dagnet can moderate. Maybe we can take one question and we proceed with the next.
Okay. Thank you, Dr. Goitom. Any question regarding the presentation? Any question, suggestion, or comment? We are waiting. ቅድስት ሄሎ ቅድስት
አይ ይለፍና ደግነት
ደግነት አቤት ዶክተር
ይለፍና ወደ መቀጠለው ቀጥታ ይለፍና ጥያቄ ካላችሁ አንድ ላይ ይጠይቁ። ያለው ሰዓትም ትንሽ ስለሆነ ይቀጥል። ዶክተር ጎይቴም ወደ መቀጠለው ቀጥልና አንድ ላይ ይጠይቃሉ ጥያቄ ካለ።
አንድ 5 ደቂቃ እንሰጣችሁ አይሻልም? በኋላ ላይ ከምንመለስ
ኦኬ
ይሻላል። ዶክተር እንዴት ነው?
ኦኬ አንድ ላይ
ያው ሀሳብ አስተያየት ያለው እዚህ ላይ መስጠት ይችላል። አሁን ቅድሚያ ወደ ሌላ ርዕስ ከመሄዳችን በፊት ሌት ጎ ኤኒ ኮሜንት ኤኒ ሰጀሽን ከሌለ
ብንቀጥል ይቻላል።
እንቀጥል በቃ ዶክተር እንዳሉ። አሁን ቀጣዩ ርዕስ ዶክተር
እሺ the next is food and water safety. Chapter description. This chapter describes good hygiene and food safety practice as well as measures to take to prevent food contamination while transportation, preparation, storage, and serving food in the primary healthcare setting. Chapter outline will be principles and standards of food safety and primary healthcare setting, main cause of food contaminants, measures to prevent food poisoning, drinking water quality and safety measures, and then summary.
ዶክ
The principles. Hello, ደግነት
ይቅርታ እንዴ ፓወርፖይንቱን ሼር
ራቀ
ፓወርፖይንቶቹን ሼር እንዳረጋቸው ቴሌግራም ላይ ወይላ
ልክ ያለው
አሁን
ልክ ያለው በአንተ ቴሌግራም በአንተ በኩል ነው ያለው። ከዛ ስክሪን አድርገው። እሺ
ወደ እኔ ላከው፣ ሼር ላድርግ።
ወደ አንተ ላከው። እሺ
ደግነትም ሼር ማድረግ ይችላል። ካልበለዚያ